Now, like all parts of our health system, pharmacy staff have been working hard to fill the public's demands, but confusion about access to RAT tests is seeing potentially positive COVID cases show up in store. To explain this, I'm joined by Westmere pharmacist Sam Tibshirani. Thank you very much for joining us this morning, Sam. How often would you have people coming in with COVID-like symptoms?
Good morning, thanks for having me. This week we have had an increasing number of people coming into store with COVID-like symptoms, specifically letting us know that they have COVID symptoms and they're seeking a RAT test. We haven't seen a lot of this during the pandemic, but with this talk and the increased use of RAT tests at the moment, I think people feel as though coming to the pharmacy to get a RAT test is the right thing to do, and so they're here in store when they are symptomatic. This is not what we want people doing, and I think the message needs to be really clear that if you are symptomatic, you need to be going to a testing station or following the advice from Healthline about where to go to get the appropriate test.
Well, and what do you have in terms of stock of RAT tests anyway, and who you're able to give it to if you do have any?
Yeah, so at the moment, pharmacies can only be selling RAT tests to businesses to use for their staff. So we're not giving any RAT tests to people who are symptomatic or no one who's a close contact. Some pharmacies are offering a service where if you're unvaccinated and you need to cross the border, you can come in and get a supervised RAT test on site. That's a really small number of people. So yeah, pharmacies really only at the moment have tests available for businesses to purchase. Those tests are, the stock's a little bit hard to get a hold of, but that is starting to come through the pipeline now.
Well, yeah, because we are expecting an announcement today on when or potentially if we're going to move into phase 3 very shortly. On the government website, it says under phase 3, collection points for RATs may include pharmacies. Now, if we were to move to phase 3 today or imminently in the next few days, are you prepared for that, for people to come and expect to get RAT tests from you?
We're not prepared for that today. Those RAT tests will be supplied to us from the government, and I believe for free or at a really low cost to businesses who are deemed critical. Those haven't been sent to pharmacies yet. That announcement, I think, only came out yesterday, so we're yet to get sort of updated on what's happening there. We would just really like to make it clear to everyone involved, whether that is government officials who are putting pharmacies up as collection points, that we can't be supplying tests to symptomatic people. We're not geared up, we're not PPE ready for dealing with a huge influx of symptomatic people.
Yeah, and so you have to keep your doors open. So how tricky is it at the moment when you're all being exposed potentially to people with COVID symptoms? How tricky is it to stay open to try and help service the public?
Yeah, at this stage, we really don't want to be going back to that level 4 lockdown procedure that we did last year and the year before. We are trying to have this living with COVID approach, have our doors open, do what we can to, restrict entry and maintain physical distancing in store. We really don't want to go back to that really strict, screen at the door, super restricted entry. So we can do that provided we don't have high-risk people coming in. So if people are coming in, they don't have symptoms, they're not a close contact, they haven't been told to isolate at home.
We may have lost you, Sam. Sorry,
we might have to go back.
Have to leave it there. But Westmere pharmacist Sam Tibshirani, thank you very much for that insight this morning.